This is EmergencyFD Storyline.
Even coming back to this engine house the day that two members were killed and a close friend was killed, you know you have to do your job. That's part of being a fireman. You can't just quit, curl up in a ball, lay in a corner and say, I've had enough. You've got to do it.
Words that inspired this podcast. Plus, we continue with a Storyline Extra on the COVID-19 crisis with the president of the International Association of Fire Chiefs.
I had a fire chief in Florida outright tell me that a state health official told him that you are not the priority. Firefighters and paramedics are not the priority, that the healthcare workers are the priority when it comes to PPE. You know, and again, I go back to one of my original statements, Tom, is how do you think these people got to the hospital?
The views expressed on this program are from the guests and the host alone and do not necessarily represent the views of any government agency, private company, or public service. I'm your host, Tom Mann. EmergencyFD Storyline's focus is to tell the stories of those in the fire service and to highlight what matters to our first responders. And there are many stories coming. This is an EmergencyFD Storyline Extra. We continue with the COVID-19 story. The question is, how will it affect the fire service? What are the challenges to the status quo? Now to our storyline. With me is Chief Gary Ludwig, president of the International Association of Fire Chiefs. He's also the fire chief in Champaign, Illinois, and the former deputy fire chief in the Memphis Fire Department. He managed the EMS system for a while. That is a busy EMS system in Memphis. And I know you spent time in St. Louis as well. That's where you started off. Is that correct?
I was fortunate to be hired by St. Louis about 2 months out of high school. And it's amazing how that all worked out. And got hired by St. Louis. We spent 25 years there and retired as the chief paramedic of the fire department there in St. Louis.
The question is, what have you not done?
I don't know. That's a good question. God has blessed me in many ways, and to work 35 years in two major city departments, and then also be blessed to be the fire chief here in Champaign, Illinois, be president of the International Association of Fire Chiefs. I just consider myself very fortunate and blessed that God has put me in these positions as he has.
And he's definitely used you, that's for sure, and still using you. Let me start off with a 101 questions for those who may be listening to this podcast that aren't firefighters, paramedics, EMTs, aren't in the fire service. What's the big deal with the COVID-19, how it affects our first responders?
It's operational and economically. As I like to say, we are the warriors at the tip of the spear in this battle. When we see the nurses and the doctors and all the wonderful care they're doing in the hospitals and the emergency rooms and on the floors, how do you think those patients got there? They got there through the fire service. We are the largest provider of EMS in the United States. And it's not only our ambulances, but it's those first responders on those engines that are going there and treating, caring, and transporting these patients to the hospital on those ambulances. It has hit us operationally. We have had, as best we can document so far, 19 firefighters or paramedics that have died directly as a result of this, over 1,000 that have been infected, over 5,000 that have had to be quarantined that we know. We think those numbers are much higher on the quarantine side. And then we start looking at the economic impact of that. We got to pay those people still that are out quarantined, those people that are out sick. You got to pay people to come in and fill those stations and backfill on those stations. So there's an economic impact and the operational impact. And then the lack of PPE, talking about operationally, we are experiencing large shortages of PPE out there for our firefighters and paramedics on the front lines at the tip of the spear. And so I have been fighting at the national level to get PPE for our firefighters. We need to be prioritized the same as anybody else. And so it is such a broad spectrum. We've paid extra overtime for the staffing of emergency operations centers and the other things. I've had to convert one of my lieutenants to an infectious disease officer. He's on a 40-hour week now. So I got to pay overtime for somebody to come and fill his shift. So it's an economic and operational impact at all levels.
So cities have usually greater resources, greater numbers of personnel. You got a smaller department. I was talking with one the other day. We have 8 guys. If one of the guys gets sick, then everybody else has to take over and work. Go into specifics on that, how detrimental that can be to a community. You can have a whole engine house out. What does that do?
Well, you're exactly right. And that's paid. So think about the volunteer side of it. they have been unable to fundraise. You have older volunteers who might be in their 50s or 60s that have a pre-existing condition. Well, they're not coming out on these calls. So you lose those aspects. You lose those volunteers. You lose that aspect of your operations. And so you're absolutely right. These smaller departments really feel the impact. At least the larger cities are able to backfill and they have available resources. But my community, I have enough resources. But what about the smaller communities? You're absolutely right. And I saw an article, but it is hitting the major cities also. I saw that a entire fire station in San Antonio was shut down, not because of staffing, but because of the fact that it had to be cleaned and cleansed out. Everybody came down with the coronavirus there. So, but going back to your original comment, Tom, yes, these smaller communities, it's hard to do that type of planning, that type of staffing, when maybe you said one, but what happens when 3 or 4 people have to go out, or they have quarantine in place for 14 days because of the fact that they were exposed? That there's an economic impact there that is untold.
Back to the PPE issue, I heard you talking about this, I think, on Fox News, that some departments are having to go and buy items that aren't necessarily designed for what is being done in the fire service.
Yes. I know that Phoenix had to go and buy ponchos for their firefighters because they couldn't get enough PPE. I know of another fire chief in Missouri that had to go buy raincoats to try to protect his personnel. I've seen pictures from around the country where you might have just enough equipment to protect maybe the 2 initial providers, but there's 2 other firefighters who are standing there that don't have the full protection. They're there to help, but they can't get as close as the other ones that render care to the patient. So we have been challenged with this PPE issue, and I have been fighting at the national level at arm's, or I shouldn't say arm's length, but as much as I can. I had a great conversation with the FEMA administrator for about an hour on Wednesday, and I asked him the point blank question: do you consider firefighters and paramedics on the same level of prioritization for PPE as you do healthcare workers? And he said yes. I said, well, therein lies the problem. I said, you might be accepting that, but at the state levels, they are reprioritizing that equipment. And I had a fire chief in Florida outright tell me that a state health official told him that you are not the priority. Firefighters and paramedics are not the priority, that the healthcare workers are the priority when it comes to PPE. And again, I go back to one of my original statements, Tom, is how do you think these people got to the hospital? They are that sick that they're calling 911, and we are the ones that are transporting and caring for these patients to the hospital. So for a state health official to say that to a firefighter, and actually with a bunch of firefighters in that conference call, is unconscionable. That is so irresponsible. I guess that's the best way to say that. The important part is we got to fight to continually get PPE. If I can just roll on just a little bit more, I told the FEMA administrator, just like when they send highway funds to states, whether it's Illinois or Missouri or Florida, there's conditions attached to that. They don't just give that money to the state and they can do with whatever they want with the highways. There are conditions attached to that. And the same should be true for PPE and anything coming out of the strategic national stockpile. Whatever FEMA is putting in there and they're giving to the states, there should be conditions attached to that. And one of those conditions should be that firefighters and paramedics are a priority, equal tier 1 priority, just like anybody else.
In the past, I have always encouraged firefighter leadership to be proactive, educating the citizens, but it's also, I think, what you're talking about, a lack of education, understanding how the entire system works. A first responder is what first? I got a wife who's been a trauma ICU nurse, but and I got a son who's in EMS and fire, and it works hand in hand. I wonder if it's just lack of education, lack of understanding. What do we need to get the message out?
I don't know, but we're going to continue to hit on it. As I like to say, there is no 912 on the dial. There's only 911, and we are the first responders. There is no other 912. There is nobody else to call. There is nobody. We are it. And so you're absolutely right. And so it's so imperative and so important that when we talk about 19 deaths so far, over 1,000 firefighters that have been infected, that it's so important that we protect them and do what we can for them.
Ongoing issue, I think, that we'll be dealing with for a while. Also talking with Raymond Chiosa, who's the 911 director for Memphis and Shelby County. He told me the other day that they're going to spend almost $1 million just in keeping things clean, sanitizing, he said, over the next few months. And that gets into budgets. How has this affected fire departments across the country with budgets?
We at the IFC, I've asked our chiefs to fill out a survey. The impact dashboard of that is live on our website. And about 1% of the fire departments in the United States have responded to that so far. They're already projecting a $400 million, over $400 million when I looked this morning, economic impact to their budgets on this. Repeated stories of around the country of firefighters that are being told that you're going to probably get laid off. I know of one fire chief that's a friend of mine that already is being furloughed 1 day a week, which is a 20% pay cut. I know one fire chief I talked to told me that about 190 out of 196 employees, firefighters, he's already going to be told to lay off 36 of those. The list goes on and on of what we're going to see economically to our budgets. That's why I have written Congress and I've written the president. I've asked for $5 billion to be put into our AFG, which are our assistance to firefighter grants programs. Also, $5 billion to be put into our SAFER programs, which is an acronym for Staffing Adequate Fire and Emergency Response. It's not only, again, the career, but the volunteer side. Volunteers need to be able to still recruit and retain. They need to make up for the deficit they've had from unable to be able to do fundraising. And I keep telling, when I speak with the White House, I spoke with the White House on Friday. I've spoken with 6 different staff and from House and Senate appropriations committees already. We're not asking for the add firefighters. We're asking to just retain the existing response force that we have out there. And so I'm hoping that the next stimulus bill coming out, they will fund those 2 programs at the levels that we request.
Somebody wants to find out more information about that. You said it's on the website at International Association of Fire Chiefs?
That's correct. It's our website, which is iafc.org.
Okay, I want to be sure to get that across if anybody hasn't checked into that. Another thing with that budget issue, furloughing individuals or having people losing their jobs, that's going to have an impact if we have a second wave or we have a resurgence of something coming up in the next few months. And I've heard all kinds of possibilities that could happen. That will be a big problem when you're all of a sudden don't have the personnel you did have.
That is absolutely correct. As I said, we need to have a ready response force in our communities ready to go for that next crisis, that next emergency when you call as a personal level, when you call 911, when we have a regional event, maybe a bus crash that happens that you have to call in resources from surrounding communities, or that next natural disaster that happens in our country, whether it's a pandemic or a hurricane or an earthquake. We got to have a ready response force ready to go. We would never cut our military in the middle of a war. We wouldn't reduce the number of soldiers that we have. So why would we ever talk about cutting our firefighters and our paramedics during the middle of a war like this? So the same principles apply.
And again, the concerns you have with the federal money that's being distributed, you mentioned just a little bit about funding certain programs. I know you've been involved with some efforts to let legislators know what needs to be done or appropriated. Any details on that that's going on?
No, other than, they're listening to us, and there's a lot of noise up on Capitol Hill right now. So we got to rise above that. And we're also, as you saw it on Fox, we're also doing media. We have actually media consultants that are helping us get the word out. I just did a spot with CBS Radio News the other day that will go nationwide to all their affiliates. I've been speaking to the Wall Street Journal, other Capitol Hill reporters, and we're going to continue to hit on that. And then eventually we're going to do a call to arms that we're going to ask all the firefighters in the nation to call your representatives in the Senate, in the House, and tell them this is what we need. Hopefully we will do that once we get some legislation in this next stimulus bill. But we're going to fight for that, and we're going to do a call to arms, and we hope that we can bombard those leaders in Congress with our phone calls and our letters.
Any other advice too with mayors, aldermen, et cetera?
Well, a lot of those elected officials find themselves at the local level in dire straits. You can't shut down economies like you've done for this period of time. And as in my case here in Champaign, we got the University of Illinois here, and we have 55,000 students here, and you send them all home. Well, how do you think that's going to impact your local economy when they're not buying the Domino's pizzas and things they buy as students, and they're, and the people that come and visit them or come to the sporting events are not staying in our hotels, and that's all lost revenue to our community. And so our local leaders, our mayors, our city managers, our elected officials and the councils, they're faced with dire situations on what to do. And so We shouldn't always rely on the federal government. A lot of people will say that, but there are times when we do have to rely on the federal government. My part is if you can bail out, Ruth Chris Steakhouse and Shake Shack and all the other ones, why would you not have a ready response force ready to go in your community by funding the AFG and the SAFER grants?
What do you have to say to the rank and file and the leadership in the fire service during this COVID-19 crisis?
That's a good question. So, off the top of my head, I just say be leaders. People are looking for direction at this point. People are looking for leadership. People are looking for decisive action. To sit on your hands and do nothing during this is not leadership. And if that's how you're doing things, you shouldn't be in a leadership position. This is the time that you should be stepping up and leading. And so, it is so important that you prepare your departments for what may come. It's so important that you prepare your firefighters for what they're currently doing. And I would say sit down with your leaders, your local leaders, and talk about where can you find some budget reductions within your budget that doesn't include staffing. And that's what I'm doing. We're looking at every nickel and every dime and looking at everything we can do that when that conversation does come, how do I present, instead of letting them drive the narrative, how do I, as the fire chief, help them drive that narrative?
By the way, love your name. Again, my favorite drums were Ludwig back in the day. I heard your name. I'm like, got to be a good guy. Ludwig drums, always the good stuff.
Yeah, I wish I was the heir to that. I'm not. So, as I say, I'm on a first name basis with the electric man when he comes once a month to shut it off. So, um, you know, so as you know, we don't get rich in public service, but we do have a satisfying life, and the fact that we walk away knowing that we've made a difference in our communities. And so, yeah, the Ludwig drums. I played the organ, so there was Ludwig Aeolian. That was also an organ company, and so a lot of people thought when I would, show up at a Ludwig place and have the name Ludwig that I was. No, I'm just there to check out the organs as I was doing. So,
By the way, I want to remind people that you're also an author, 3 books. You got Fully Involved Leadership. That's the latest one.
yeah, fully involved leadership is my latest one, and that is not anything to do with theory. That is actually practical advice. One chapter in there is an example. I'll just give an example. Talks about I before E, and I before E is using your intelligence before your emotions. And so many times we see chief officers, company officers, somebody walks in their office and says X, Y, and Z, and the fire chief or A, B, and C, and the fire chief reacts like, I, I got to do something right now. And it's a lot of times is the wrong thing to do because you're acting on your emotions. And so we in the fire service, we are trained, and that's all we've done our whole careers. Confront it with a problem. We have to make a decision right now. We have to solve it. We have to find a solution. We do that on scenes every day. And sometimes we take that back to the office as the fire chief, and somebody walks in with the problem. We go, and our training is such, and our inclination, and it's embedded in our heads, is I got to make a decision right now. I got to solve this. And I've tried to teach them in that chapter, I before E, you have the luxury of discretionary time. You're not on an emergency scene. Take a pause, take a breath, use your intelligence before your emotions. I like to commonly confer with my human resource department or my legal department before I make a decision. And that has done me well. Instead of being reactionary to the first thing I hear, which and react to that might be the wrong decision. I step back, take a breath, wait a day or two, confer with others, and try to come up with is the best solution or the best way to approach something.
2 other books too, Blood, Sweat, and Tears and Prayers.
Yeah.
Like that one. And Welcome to the Butterbeck School of Mismanagement.
Yes. So Blood, Sweat, and Tears talks about my 35 years working in St. Louis and Memphis. Tells a lot of stories there. It's pretty much written for the layperson also, that if you were not a firefighter or a paramedic, that you would have an understanding of things because I kind of explain things in there. And the Welcome to the Butterbeck School is kind of a satirical look at someone, wants to be a terrible leader. And because I've worked for some of these people in my lifetime, and I'm thinking, my God, you can't be this dumb to make this type of decision. And so I concluded, which is the book draws that conclusion, is they went to school to learn how to be idiots. So, and make these stupid decisions that they make.
I've heard that across the board from everybody. Every leader, by the way, has said that either somebody inspired them or et cetera, et cetera. You hear that everywhere.
I've learned more on what not to do than I've learned to do from my mentors. And I've had some wonderful mentors over my career, but I just shake my head and just wonder, how do you get to these levels and you're such a blooming idiot. I don't know how to say it any other way, but I've worked for them, and I thank them for everything they've done to teach me what not to do in my career. Um, and I will add a fourth one coming out. I got a book that's being edited right now called 401 Things Veteran Firefighters Can Teach You.
Oh,
That I hope to have that out soon. It's being edited right now. But that's it's all the little tricks of the trade and all the little things that I've been able to learn over my career, and what I picked up from others that have taught me or contributed to the book. And it's just all those little things that's broken down into what to teach your rookie on your first day, engine company operations, building construction, training. Just there's I think 13 different chapters there that talk about all these little tricks of the trade that veteran firefighters can teach you.
if anybody wants to get hold of these books or have you speak anytime in the future, they can go to your website. Isn't that GaryLudwig.com? Is that correct?
Yeah, that's my website, which is GaryLudwig.com. And if you're interested in ordering any of those 3 books that we originally talked about, those are links on there to Amazon or Audible that you can buy those books.
Want to talk with you in the future about some other events and things going on about leadership, so much more. Hopefully things will get much better, and I appreciate you taking time. Chief Gary Ludwig, who's the president of the International Association of Fire Chiefs. He's also the fire chief in Champaign, Illinois. Thanks so much.
Been an honor to be on the show.
You're listening to EmergencyFD Storyline. I'm your host, Tom Mann. I want to take our remaining time to share part of a powerful interview with a firefighter legend. Less than a year ago, I went by to see this particular firefighter. He had just retired from a career in firefighting. He began to open up about his time as a firefighter. At that very moment, I thought, people need to hear this. More than 25 years ago, I recorded Lieutenant Jim Cunningham from the Memphis Fire Department. He's that firefighter. His words put a passion in me to tell the stories of the members of the fire service. And what you're about to hear was recorded just a few weeks after 2 firefighters lost their lives fighting a fire in a high-rise building at 750 Adams in Memphis, also known as Regis Towers. The 2 firefighters were Lieutenant Larry Mathis and Private Billy Bridges. Lieutenant Larry Mathis was Lieutenant Jim Cunningham's best friend. While the tragedy was still fresh on our minds, I asked Lieutenant Cunningham in an interview one question: what is it like to be a firefighter? And tell me about the sacrifice. This was his response.
Being a firefighter is kind of like being a big kid. It's exciting. It's can be fun. It's not routine. It's not mundane. It's not sitting behind a desk. It's all about helping people, serving, dedication, love for your fellow man, wanting to be there in time of trouble for somebody else. It's rushing into a situation that's out of control, going into that fire building when everybody else is running out, and you're supposed to go in. It's responding to wrecks and holding a victim's hand and telling them it's going to be all right. It has to do with compassion, teamwork, sacrifice, hard work to the point of exhaustion a lot of times. Matter of fact, hard work to the point where sometimes you wonder, why am I doing this? It involves physical injury to yourself a lot of times and wear and tear on your body. There's no denying that. Your lifespan definitely will be shorter than the man that punches a clock 8 to 5. A lot of times I kind of wonder, why am I doing this? The fact that you remember going and doing CPR on this gentleman. Here it is 2 or 3 years later, and someone walks in and gives you a cake for your engine house and says thank you. That's what it's all about. It involves extinguishing fires, automobile extrication, assistance calls, power outages, elevator rescues, high-rise rescues, just any situation where the average citizen needs help and is calling for help. That's what firefighting is all about. I think the average person out there sees firemen as people that have a lot of time on their hands, that sit around, play cards, play ping pong, sit out front of the engine house, wave at the people, go by, eat, watch TV, sleep. They're not around when we're training. when we're studying. They're not around when that alarm goes off at 1 o'clock, 4 o'clock, 5 o'clock in the morning to see us when there's actual situations that people are in need. They're not up at 1 o'clock in the morning when we're going to 750 Adams with the 9th floor on fire. People hanging out of the windows. The sacrifice that's given by these firefighters, no matter where you are, given to the point of giving your last breath to get someone out of an apartment. 2 firefighters at 750 Adams, citizens didn't see them, the average person didn't see them struggling in the hallway doing their job. People were asleep in their beds, sound safe. We had companies on the scene fighting a high-rise fire. No one else was disturbed, everyone else was asleep in the city. These men down here were on the 9th floor battling not only a fire and to save other people's lives, but in the end they were battling to save themselves. People don't see that sacrifice. It's part of the job, and I've said before, I'm glad that it doesn't happen every day. These men gave everything they could give. They rushed into a situation that was out of control and tried to restore order to that situation, and it ultimately cost them their lives. No one knows how many lives were saved due to their actions. That's one part of firefighting, I guess, that the average citizen doesn't see. The real sacrifice and the real emotion and anguish that goes on in one of these buildings when it's on fire. One of these firefighters was my counterpart up here on Engine 7. He was a very, very close friend. Known him quite a while. It's kind of tough having to report to work and be told that your best friend may not make it through the night. It was kind of tough going to the med in the burn unit and being told that he didn't make it. I think the comforting thought about that was the fact that I knew Larry Mathis, and I knew what kind of fireman he was and what kind of man he was. He was tough, and it must have been something tremendous to take his life, and a tremendous effort on his part at that fire. I came back to work that Monday morning. Of course, this whole engine house was shaken, to say the least. But you know, even coming back to this engine house the day that 2 members were killed and a close friend was killed, you know you have to do your job. That's part of being a fireman. You can't just quit, curl up in a ball, lay in a corner and say, I've had enough. Larry Mathis wouldn't have done that. Billy Bridges wouldn't have done that. Firemen are not some big macho men that don't have emotions. That's not what firefighting's all about. It's not what being a fireman's all about as far as I'm concerned. And it wasn't as far as Larry Mathis was concerned. Part of being a good fireman is having compassion for one another and for people. Even though it was difficult to come back in here, and it's still hard to come in here sometimes, you've got to do it. I think if the roles would have been reversed, Larry Mathis would still be coming in here doing his job every day, probably with more grit and determination than before. The people that say that you have to work through these things and go on with your life, sure you do. There's no doubt about that. It's where you draw your strength from that allows you to do that.
Lieutenant Jim Cunningham more than 25 years ago. By the way, I originally recorded this interview on video, and years later it was seen at the Memphis Fire Museum and on various fire training networks. That's our storyline. Before I go, I want to pass along some more information about the EmergencyFD Storyline podcast. This podcast can be heard on various outlets on podcast directories like Apple Podcasts, Google Podcasts, Spotify, Stitcher, Podcast Addict, Podchaser, Deezer, Listen Notes, as well as our host, Buzzsprout. And you can find this podcast on our website at EmergencyFD.com. And if you have any questions, comments, or suggestions for stories, you can email us at storyline@emergencyfd.com. That's storyline@emergencyfd.com. I'm Tom Mann. I want to thank you for listening and thank our guests for their time and perspectives. There are many more stories coming on Emergency FD Storyline. Join us.